My name is Lorraine, and I'll be your student family nurse practitioner today.
Hi, Tyler.
Nice to meet you, Tyler. We're going to get started on a head-to-toe assessment for you today. I'm going to first start by inspecting your head, okay? Everything seems normal shaped here. I'm going to inspect your hair, looking for any bumps, lesions, any pain or tenderness while I do this?
No.
Okay. Everything seems within normal limits here. If I could get you, can you tell me if you can feel this?
Yes.
Okay. Now, can I get you to please close your eyes? And can you tell me if it's sharp or soft?
Sure. Soft. Sharp. Soft. 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 Sharp.
Right, cranial nerve 5 is intact. Can I get you to smile? Frown. Puff your cheeks. Cranial nerve 7 is intact. Now, I'm going to palpate your sinuses, okay? Any pain or tenderness while I do this?
No.
Now I'm going to test your eyes. Can I get you to do not move your head, just follow my finger with your eyes, okay? Six cardinal gazes, no involuntary shaking there. Now we will test, let me look with a light. Okay, red reflex noted, optical disc in view, and vessels and retina are seen in both eyes. Eyes are equal, round, and reactive to light. Now, can I get you to follow this into your nose? If you just keep your eyes on it, okay. Convergence. So that means cranial nerves 3, 4, and 6 are intact. Now, I'm going to test your hearing, okay? So I'm going to whisper a couple words on each side, and you tell me what you're hearing.
Ball. 6. Apple. Banana.
Okay, gross hearing intact. That means cranial nerve 8 is intact, okay? Now I'm going to cover up each nostril and then I'll have you blow, okay? The other side, cranial nerve 1 is intact. And we'll pretend that I have a tuning fork, okay? I'm gonna hit it, place it on top of your head, and the patient would tell me if he could hear it symmetrically, laterally intact on both sides. Can I get you to open your mouth for me? Tongue resting midline, that means cranial nerve 12 is intact. Stick out your tongue, indicates cranial nerve 9 is intact. Now, can I get you to open your mouth and say ah?
Ah.
I can visualize your uvula going up, so that means cranial nerve 10 is intact. I will also, can I get you to open your mouth? Okay, I'm just gonna inspect and see, make sure I don't see any lesions, any discoloration. Your palate looks good and no obvious cavities or dental issues here, okay? Mouth is moist, pink. Now I will get you, I'm gonna put some weight on your shoulders and please shrug. Okay, cranial nerve 11 is intact. Now I'm gonna check your ears. Have you noticed any pain or drainage in your ears?
No.
Okay, how about on palpation?
No.
Okay, and this side?
Oh, good.
Okay, I can see your eardrum, tympanic membrane, pearly gray. Next side. I can see your eardrum here, and tympanic membrane is pearly gray. Cone of light noted on both ears. Okay, so we are going to move to your nose. Have you noticed any drainage coming from your nose?
No.
Now, we've inspected your mouth, okay? Everything is okay there. We'll move on to your neck. So I'm looking at it, it looks within normal limits, no obvious bumps, skin is intact here. I'm gonna palpate your nose, okay? Preauricular node, posterior auricular node, tonsillar, submandibular right here, submental nodes here, superficial cervical, deep cervical nodes, posterior cervical, supraclavicular, and occipital back here. No inflammation I feel, no obvious bumps, everything seems within normal limits. Any tenderness? Everything looks symmetric. I'm going to palpate your thyroid, okay? Normally I would get right behind you, but. Any tenderness or pain?
No.
Thyroid is midline, within normal limits. Okay, now, can I get you to put your hands over your head? Okay, down into a T. And let me check your carotid pulse. +2 each side. I'm going to check your brachial pulse, okay? +2 on his left. +2 on the right. Now radial pulses. +2. And +2. Okay. Can I get you to squeeze my hands? And pull me towards you against resistance. Pull me towards you. Okay. And push against me. Okay, can I get you to go up? Move your wrists around. Okay, wonderful. Let me check your reflexes, okay? We're gonna pretend that I have the tool for that. So, bicep, tricep, bicep, and tricep. Okay. Now, inspecting your chest, okay, everything looks within normal limits here. Any issues with breathing lately, shortness of breath?
No.
I'm gonna listen to your heart. Okay, first we'll do aortic, right side, second intercostal space. Following the second intercostal space, listening to pulmonic on the left. Third intercostal space, Erb's point, S1 and S2. Lower left sternal border, fourth intercostal space, the tricuspid. And Fifth intercostal space, mitral is medial to the midclavicular line. I'll do the same with the small bell of my stethoscope. So we have aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. Now I'm going to listen to your lung sounds, okay? Can I get you to breathe in? Out. In. Out. In. Out. In. Out. In. Out. In. Out. Okay. Lung sounds are clear bilaterally. I'm gonna go towards your back now, okay? Looking to see just normal observation here. Skin is normal for ethnicity, okay? No unusual skin characteristics. Can I get you to breathe normally? No use of accessory muscles, no retractions, heaves, dyspnea, and everything looks symmetric here. Now, I'm going to do the Fremetis test on you, okay? So I'm gonna place my hands in 3 different spots. You're gonna say the number 99. Go.
99, 99, 99.
I'm gonna actually have you turn facing that wall so that the camera can see this test. Again.
99, 99, 99.
Big deep breath in and out. Nice equal expansion, okay? And I'm gonna listen to your lung sounds on the posterior side using the diaphragm. Okay, so I listen for lung sounds on each side of the chest in 6 different places. And now we will listen laterally, okay? Okay, listen laterally in 5 different places. Now, if I can get you to go ahead and sit facing this way again. And we're gonna go down to the lower extremities now. Any pain or tenderness on palpation here?
No.
Okay, have you noticed any sort of edema going on lately? Okay, everything looks symmetric here, no unusual skin characteristics or uneven hair distribution. Okay, now I'm going to check your tibial pulse. Go ahead and, let's see, go ahead and lay down for me so that the camera can see. All the way back so your feet are up. Okay, great. All right. Checking the posterior tibial pulses. And that's +2, dorsalis pedis pulses on top of the foot. That is also +2 on both sides. Now, nails, nail bed looks good, no sort of clubbing, no cyanosis in the nail beds. Can I get you to move your ankles around for me? Show me the range of motion. Okay, now resist. Perfect, and toes to your nose, wonderful. Now if I can get you to sit back up, please, and towards the edge of the table. I am going to test your patella reflex, okay? Pretend that I, again, have the correct equipment for that. Okay. Even on both sides. Now we'll do the Achilles. Can you see? Go ahead and kind of scoot yourself back a little bit, and we'll do the Achilles reflex and Babinski in adults. Non-reactive, okay. Now, if I can get you to stand up for me. Okay, can I get you to lift both your legs up high? Okay, now I'm gonna just look at your overall gait. So if I could get you to just walk in that direction and back for me. Okay, normal gait, symmetrical. And if I could get you to walk on your tippy toes in that direction. All right, and if you could walk on your heels back. Now, can you walk heel to toe in that direction, please? Okay, good posture, and come back towards me. Okay, can I get you to lift your arms and close your eyes? Okay, open. Thank you. Now, one thing I did forget to check is I forgot to inspect your hands, okay? I am doing capillary refill. There's no clubbing, no cyanosis here. And if I could get you to take a seat, please. Okay. Posture looks nice here. I'm sorry, sir. I can have you stand up, please. Right here. Now go ahead and touch your toes. All right, I'm just looking at your spine here, running my fingers down. Everything looks, spine looks nice and straight. And your hips here are even. Okay. Go ahead and turn towards me. Backtracking a little bit, I'm going to auscultate your temple, okay? No bruise noted. Now I do need to do an assessment on your abdomen, so if I can get you to lay down, please. I'm gonna stand on the patient's right side. Okay. So just an overall look here. I don't see anything out of the ordinary. Everything looks symmetric on the patient. At eye level, stomach looks nice and flat, okay? If I could get you to lift your head and look towards your toes. Okay, and relax. All right, I don't see any protrusions here. Patient's face looks nice and calm, so he's not in any distress, so there's no note of a hernia. I'm going to listen to your abdomen in all four quadrants, okay? We'll pretend 1 minute each. Active vowel sounds in all four quadrants. Now I am going to auscultate the aortic artery, renal, okay, on each side, and iliac on each side. No roots noted there. I'm going to percuss in all four quadrants. Okay. And I will be checking for, excuse me, liver, palpating liver. I'm gonna put my left hand under your ribs. There we go. Can I get you to take a deep breath in and out? Okay, now the spleen. Deep breath in and out. No organelle there. I'm just going to palpate here. Light palpation. Okay, deep palpation. Any pain or tenderness
No.
in any quadrant of your belly?
No.
Okay, great. Go ahead and sit up for me. All right, I think that completes today's head to toe assessment. Any questions?
No.
All right, nice to meet you.
Thank you.